Good morning, dear guests. I will move to French because due to the YouTube recording, I need to make the presentation in French, so I will move in French, I'm sorry. Donc je suis extrêmement ravi d'être présent ce matin avec vous. Monsieur Martin Hirsch, qui est le directeur général de l'assistance publique Hôpitaux de Paris, le système universitaire hospitalier public de Paris, a été obligé de rester sur place en France et n'a pas pu venir aujourd'hui se joindre à vous en raison des attentats récents qui se sont passés à Paris. Il regrette beaucoup de ne pas être là aujourd'hui et je souhaiterais témoigner en son nom son grand attachement à l'Inde et la population indienne qu'il aime beaucoup. Je vais donc faire sa présentation qui concerne les coopérations hospitalières internationales avec ses aspects stratégiques et pratiques. Et en particulier sur ces quelques diapositives, je vais tout d'abord vous présenter les éléments d'orientation vers quelle voie chercher, et notamment faire de la collaboration internationale, c'est essayer d'améliorer le progrès médical et d'augmenter l'espérance de vie, mais c'est également partager des objectifs communs de santé publique. Je vais donc vous présenter ces deux aspects brièvement et je terminerai par une présentation générale sur le système hospitalier public de Paris qui s'appelle l'AP-HP. Il est donc indéniable qu'on assiste à une augmentation de l'espérance de vie à travers le monde. Voici quelques éléments de données françaises qui montrent qu'entre 1950 et 2000, l'âge moyen chez les hommes et chez les femmes est passé en moyenne de 46 ans à plus de 65 ans et est actuellement même à plus de 70 ans. Tout ceci a bien sûr quelque chose qui est mondial, puisque partout dans le monde, on constate une augmentation de la durée de vie des populations, avec bien évidemment des différences entre les pays. Vous avez représenté sur cette carte les données de 2009. Plus les couleurs sont foncées, plus l'espérance de vie est longue, plus les couleurs sont claires, plus l'espérance de vie est courte. Vous voyez qu'il y a une tendance à l'homogénéisation d'un certain nombre de pays, avec encore un certain nombre de pays, notamment en Afrique, dans lesquels la durée de vie est beaucoup plus courte. Quoi qu'il en soit, on peut penser qu'avec l'amélioration de l'accès à l'alimentation et avec le recul d'un certain nombre de maladies infectieuses, l'espérance de vie va globalement augmenter à travers l'ensemble du globe. Et ceci va poser des problèmes qui nous intéressent, nous, lorsque l'on essaye de réfléchir de façon transversale sur la recherche en médecine. En 2050, on comptera probablement plus de 2 billions de personnes âgées. En 2020, en France, les personnes de plus de 65 ans seront plus nombreuses que les enfants de moins de 5 ans. En Chine, la prise en charge des personnes âgées est devenue une priorité nationale. Et bien évidemment, cette prise en charge
priority, and though they will to take care of them is not mainly a medical aspect, but also we have to give them social protection and protection in their daily life. This life expectancy is also accompanied by a need for research across the countries. Especially the infectious diseases are disappearing. The neonatal mortality is reduced. On the contrary, between 1980 and 2000, the AIDS and other diseases have gone up. New diseases are appearing, whether in India or in France. For instance, coronary diseases, diabetes, certain types of cancer, but also road accidents, which are also increasing in number because of the usage of motorized transport. There are also other challenges. The people live in rural, in countryside, but they are now seen more and more in urban areas, especially in Asia, blue color, where there is a considerable rural migration towards urban centers. All that shows that we have to think of collaboration between the different countries so that we can find solutions to these problems. I'm going to end this presentation by talking to you about the public hospital system in Paris. We call it Assistance Publique Hôpitaux Paris. It is called APHP. It is a hospital, public hospital unit, which is there for more than 400 years in Paris. It was born in 1943. It was initially reserved for treatment of people without any means, poor people, and it was extended to hospital system to the public in Paris. Here on this slide you can see the different hospital systems. There are several of them. They are found in the Paris region, but also outside Paris region, especially those that are far off. And it is the first patron employer of the region, Paris region. We have more than 45,000 personnel, 20,000 doctors, 18,000 nurses, and 4 out of 10 nurses work in these establishments, in these hospital centers. This is consists of 39 hospitals with 720 medical 22,000 beds, including 350 ICU, 88 operating theaters, but also a lot of beds reserved for dialysis and rehabilitation, and the chemotherapy. 10% of all hospitalization and 6% of all emergency rooms are reserved. 1.5 million people are hospitalized. I'm not going to go into details of the same. One of the features of this establishment, it is not only a hospital establishment, but also it works outside this ambit. We have emergency services. There are 17 emergency services for adults and other services for children. More than 1.1 million people are treated this way. And also we have outside the hospital, we take care of patients whenever there is a serious emergency requirement. There are 40 medicalized cars which are found in Paris region, and they take care of the preliminary care before getting admitted to hospitals, and they also provide diagnostic and therapeutic services. So this is one of the features. And the research, a lot of research, lot of innovations are taking place. The first test tube baby was born. There are a lot of research in surgery. For instance, multiple transportation. The first artificial heart transplant was carried out. I'm going to leave a small brochure which will give you information on this multidisciplinary research. This has led to a lot of publications which have been indexed, and we have different systems of publications in the world. Of course, public assistance is a stakeholder in collaborations with health professionals, whether they are doctors or paramedicals or technicians or administrators, directors. This exchange is interested in on the technical aspects, medical and paramedical aspects, and good practices and management of hospitals and quality expertise. It is also interested in exchange programs, in training and research programs, basic research or clinical research. You can see on the slide the centers, the important centers of collaboration under the assistance publique. In India, you have a collaboration which is very interesting, which has been there for the past 7 years with the Zipmer Hospital in Pondicherry. I thank you for your attention. I'm there to answer to your questions. Thank you, Professor Henry. Do you have any questions, please, from the audience? No questions? Perhaps I can show them. Avec l'espérance de vie qui augmente, on a le besoin de transférer les patients dans la communauté. Alors donc, on a besoin des soins de prise en charge des patients par la communauté. Alors, à quel point votre assistance publique a pu gagner de notre expérience d'études? Peut-être que nous pouvons avoir une réponse à cette question après la présentation suivante. Donc, je vais passer maintenant à la présentation suivante.
Donc, I'm going to talk about the collaboration that we have put in place with the Japan Hospital in Pondicherry. Just a few words regarding this collaboration that you have. This collaboration has started in 2009, since last 7 years. We have organized 7 workshops in Pondicherry. So 168 these are the figures. So there are 55 tickets between Paris and Pondicherry, more than 175 hotel nights, 55 air tickets, and donation of 500 stents and so on. So this is a collaboration which has been done between a government-funded hospital in south of India, located in Pondicherry, close to Chennai, the Jipmar Hospital. You have some photographs of that hospital. This collaboration is not only interesting for Jipmar, but and also for another government hospital in the center of Pondicherry, in Indira Gandhi General Hospital, which is a smaller hospital which also has the cardiology department. The other part of the collaboration has been done in France through a hospital about which I have just now spoken. It's Lariboisière Hospital, which is located in north of Paris, on the northern side of Seine River, which is located to the Indian Quarter in Paris, which is a university hospital which has a very important activity of emergency, and also cardiology department, neurology, osteoarticular diseases. You can see some of the photos of that hospital. The collaboration started by a cardiologist, French cardiologist, whose father was born in Pondicherry and who has done his studies in France. And this cardiologist, Dr. Adavan, wished to do 6 months of workshop, cardiology workshop in Pondicherry, to find once again his origins. So through Professor Tribid, he contacted Dr. Santosh, who is the head of the department of the cardiology department in that unit, and he's organized a 6-month-long workshop to have exchanges on cardiology. During these wonderful collaboration period of six months, he had a wonderful exchange and saw a number of patients and came back really charged after the positive experience in Pondicherry, and spoke about wish especially to collaborate in a very close manner with the Jipmar cardiology department for coronary diseases. As you know, in fact, this is a major cause of death, the coronary disease, and as you can see, the muscle damage which occurs here, and so it is possible, and it often happens like that this artery is blocked, and one can put a small balloon inside the artery, and we can put a stent inside. In order to do this dilation, it is important to get inside the artery, and in order to get inside the artery, and what is important, the radial way is the other way, which has been used since quite long time, because it's a large artery. Since about 15 years, first the French and the rest of Europe, they moved to another mean of dealing with, that's the radial way, to get entry through a smaller artery, which is much more complicated, but probably that's more interesting to work because it doesn't lead to bleeding. So one can do a procedure which is shorter. The Indian team wanted to collaborate on that particular issue. So we organized the first workshop on radial approach in 2009 in order to exchange our views and ideas about this radial approach, and the first one went off very well. We had we connected to a collaboration for each year, and then we kept going back to Japan Hospital to work in a closed fashion. The second year, 2010, it was angioplasty through the radial approach with techniques of the latest techniques were used. The latest imaging method was also used. This is an area which is a very special one for all of us. Each year we have come to collaborate with our Indian friends on each one of these themes. So this is the poster of the last workshop. It's called IFRIC. It's Indo-French radial intervention course. From 2013, we need to know that the hospital Lariboisière, where I'm working, I'm the head of a section of a larger group of hospitals. In that group, there are several departments such as cardiology, the emergency service, the ICU, and the surgical and medical departments as well. And I think it is interesting for us to extend the ambit of collaboration to other areas. And while we are discussing with our Indian colleagues, we discovered that so we decided to work on the emergency service and the medicines which are used. So therefore, it was decided to establish a connection and a collaboration with regard to cardiology as well as the emergency, and so that the intensive and as well as the intensive care units. So from 2014 onwards and then 2015, besides the team of the emergency team with a professor in the emergency medical care, 5 specialists in the emergency medical, and also 4 nurses for 2 years. Several elements have been dealt with during the workshop. The general organization, the sifting and the checking the patients, screening of the patients in an advance, especially through non-invasive measures, and ECG have been started in 2014. What is interesting to see here is that the emergency service doctors in Japan were sort of deciding between 2 types of things. First was, so is it that the people, those were doctors, those who were posted in the emergency service, so they're just there to channelize the patients to other departments, so they are working as a bridge between other departments and the patients those who are coming, and which is also the case in France? Or is it a specialized medical department and beyond the hospital and within the hospital where a proper screening is done? So these are the 2 aspects that we dealt with, and we thought the second solution is the best. That means the emergency department is a specialty by itself, so which involves primary care outside as well as care within. So this is a photo of the emergency team. We have had other series of conferences. For instance, we had video conference. Several Indian doctors went for training program for 2 months in France. We also involved the director of the hospital group. We thought it was important to do so. and I'm going to talk about a team that we built. There are medical students, 25 of them, those who did 1 month of training program in JIPMA. Then we had the connection, privileged connection with French embassy and the French consulate during these missions. So what are the basic features of this collaboration? The first basic feature is that, and which was defined together along with the Indian colleagues, the idea is not to show something by the French, but to share. The idea is not to show, but to share, to work as a team together. The second element, that this collaboration involved the entire group of the team. It was not only a doctor, it was also the question of nurses, the head nurses. So it's an entire team who got involved in the project, in this collaborative project. So it's very important to keep this energy going in this collaboration. At the time, then each year we decided to do more than what we have done the previous year. I'm not going to get into more details about the objectives. You have on the left hand side you can see the cardiology department, and on the right hand side you can see the emergency service. In fact, there are technical objectives. There are also the quality objectives in terms of organization, and also to risk prevention, which are also very, very important for us. It's the reason for which the nurses got involved, the heads of the department got involved as well in this project. And of course, I mean, as you know, there are financial constraints. The travel of the French teams was sponsored by the French industries, paid by also the Ministry of Health in 2015. Plenty of donation of industries which was received as well, and the local hospitality was provided there at the local level. So what is the Indian feedback? So our Indian colleagues shared with us that it's the confidence which has been built, which goes without saying, that it allowed to work in a group and also to ensure visibility within the hospital community and also outside the hospital community. For instance, the journalists were invited to part, and also the industry captains. In fact, the industries were really present in JIPMAR to collaborate in these workshops. And also, it goes without saying that we have had a great deal of advancement of knowledge and experience. I'm going to talk about the research also. So this is the impact of the IFRIC collaboration, especially at the cardiology level. In 2008, all the angiograms were done through femoral, and later on is through the radial way. And this is what is recommended now. All the angiographies were hospitalized in the ambulatory way, is more than 80%, 18, 90. So 5 to 25 people have been treated. So there is an increase of number. 100% of the angioplasty patients were hospitalized, and in 15% are done through this quick method. And also we see a decrease, important decrease of the hospital stay. So the number of beds hasn't changed, 28. So we have optimized the resources, and this has enabled us to have publications by the Indian team on this experiment of this fast angioplasty. In the French side, we have had a great deal of feedback. For instance, the enthusiasm was great. It really helped to build a cohesion among the French team. It was an exceptional way of sharing and also to discuss with our Indian friends, and which has helped us to go even beyond than what we thought, because at times our Indian colleagues are moving even faster than the French ones. Then we have treated different types of patients in India, so they were proud to be able to put in practice the French experience of this APHP, and what is very important was to speak also in English. So these are some of the workshops that we have organized as part of the collaboration. How does the future roadmap figure? We are going to work hard so that emergency care medicine progresses, especially in cardiology, so that we are able to deal with all the cases could be treated by stent for life, by angioplasty. The emergency care doctors need to have a large amount of collaboration. There should be an extension to trauma care, and also extending the collaboration beyond the hospital. What is interesting is to work so that we take care of the patient from end to end. So this needs a lot of organization, and also in future we'll be doing more research. We will have more collaboration exchanges between Indian as well as French counterparts. For instance, for the emergency team in 2016 is to work more on chest pain and acute coronary problem, and also risk stratification. So this is the map, a graphic presentation of how we took care of the patients. So I'm going to finish in 10 seconds by thanking our Indian colleagues, who is Professor S. Santosh, who is the head of the collaboration in JIPMA. And I'm going to quote Mahatma Gandhi, and he has been inspired by the dynamism. Professor J. Balachandar, who is the medical superintendent of JIPMAR, has been also very helpful in this collaboration. Dr. S. Adhavan, who was the first doctor to start this collaboration in JIPMAR. Dr. Manimaran, he is in the other hospital, the government hospital, smaller hospital about which I spoke, and who is also very interested. And our nurse, Mrs. S. Ben Mebis, because as I said, because this is not only a team of doctors but as nurses as well. So is the first industry representative who has done the first of all the trip to India, Dr. Karthikeyan, who is in AIMS, with which we have a lot of collaboration in terms of research, especially in cardiology. And to end,